It's time for Back to Life, brought to you by Southwest Spine and Pain. A 30-minute conversation with their board-certified physicians about how to live life again, pain-free.
Welcome to Southwest Spine and Pain Back to Life show. Our hosts today for the next 25 minutes are Dr. John O'Bray and Dr. Jared Dupre. Welcome.
Well, we're glad to be with you today. I'm Dr. John O'Bray here in St. George with Southwest Spine and Pain Center.
Yeah, I'm Dr. Jared Dupre. Happy to be here. Look forward to the conversation.
We're looking forward to our conversation today and to answering questions and talking about some of the challenges that we see across the country at this time.
Yes. Okay, so answer this one, will you? What is happening with the problems of opioids across the country? The pain medication. Is there an alternative? Is there something that you could tell us that we have, like something we've heard about in the news?
Yeah, let's talk a little bit about what is happening across the country. I think it's a complex situation, but for anyone that's watching the news and hearing about the terrible events that many families and individuals are suffering, is that we're seeing tragedies as a result of either misused or unintended use of pain medicines, opioid medications in many cases. And, I think the problem's been developing for a number of years and to some degree has its roots in the well-intended efforts of doctors and other healthcare providers to really help people with their suffering and ease their circumstances. But, with time, we've learned that maybe there's a better way, clearly, than what we're observing in many cases today, and that the unintended consequences of the use of pain medicines for all situations with the patient's pain hasn't produced the outcome or the result that we're looking for. Today I have Dr. Dupre with me, a colleague of mine, and in collaboration with the care of patients, and I'll let him comment a little bit here too as well on this subject that we're seeing nationally.
Yeah, I think one of the things that we've been seeing, Dr. O'Bray and I actually did a little mini in-house study not too long ago about what are all the factors contributing to people's pain. And what we know, I think a lot of us intuitively, is pain is more than just a physical health thing, that pain impacts our relationships, our mood, whether it's clinically depressant or anxiety, or people just feeling down. It impacts how we deal with our work and how we have life satisfaction, and it obviously has factors with nutrition and fitness. I mean, everything is connected. So as we look at these pain patients, we're looking at them differently today. And I think in the past we thought there was maybe simple solutions to complex problems, and now we're looking at complex solutions to complex problems. And we're actually pretty excited about what we're starting to develop, and maybe reaction partially to what's going on nationally. But locally we have some really neat options that I think can help pain on a not just a physical health, but more of a lifestyle, life satisfaction level.
I'm interested about this, Dr. Dupre. Could you give an example of someone that you have been able to help, recognizing that it's far more than just, pain, that it has to associates with so many other elements and factors? Yeah,
and, we always change names and situations to protect confidentiality, but in general, I've been working with a number of patients lately where, a typical scenario is someone might have gotten into an accident, something that they're not planning, and obviously have a pain condition, and whether they pursue different options that Southwest Spine and Pain has or other pain management centers, they find over time that their pain begins to exacerbate and spread into their relationships and into their work. Specifically, recently working with a gentleman where, unfortunately, verge of divorce, relationship has changed. They used to work out a lot. They used to have a certain type of lifestyle, and all that changes after the accident. Soon he's having depression. his work productivity is low at work. He almost has a completely different personality, and that's oftentimes what pain will do, is it changes us in a lot of different ways. And so, when you look at someone like that, is it a simple solution, or do you really have to combat it at all angles, relationally, emotionally, mentally, physically? You really have to, if you really want to address the whole lifestyle, life plan of this patient. If not, it's not just a pain issue anymore. A whole bunch of what's important to their life goes down the drain, and we're trying to not just prevent that, but when you start to see that start to fall, catch it before it becomes too late.
Mm-hmm. Well, that's a good example and an overview of a little bit about that, about how important there's so many things to look at besides just the pain that they're going through. Dr. O'Bray, how can we help your patients without using opioids?
Well, that's a great point. I think fortunately, each year, each past decade, there are new technological advances that are helping us to relieve pain at the physical level better than we have before. And now a lot of these advances are making it such that we're now wanting to utilize or apply these in a patient's condition before the use of opioid medications for pain relief. So I think there's a few steps here, or a few parts of this question to answer. I think the first one is do everything we can to understand or diagnose the problem and treat it and cure it if possible. That's the ideal, and we definitely focus on doing that, even at the acute stage of a problem. Now, unfortunately, treatments aren't always perfect, and so in the case where we're not able to really take away or cure the problem, then what we want to do is manage it as effectively as possible to relieve that burden, that disruption in somebody's life as best we can. And so we do that as specialists, as a clinic that cares for patients with spine and pain conditions. And so that's what we try to do. Now, that being said, in those situations where we aren't able to cure or remove the problem, then we collaborate with specialists like Dr. Dupre to really make sure we're thinking about all these different aspects of the impact of a pain condition on someone's life. For example, their employment, their relationships, their physical activity, their usual lifestyle choices they enjoy that they may not be able to do as much anymore, and make sure that we're understanding and intervening as best a way as possible to maintain the fullest life for that patient we can. I think that's the key. Now, unfortunately, there are a number of patients where this hasn't been the process or hasn't been ideal for them. And if you want to think of it this way, sometimes, the house is on fire. And, what could have been a little problem caught early now is really a big problem. And in that situation, we just kind of bring all hands on deck to help that patient overcome those challenges. I think that's probably how maybe I could explain that process to you and the listeners today.
Thank you. That is, it sounds like from what you're saying that there, you look at ways that you can help them without using
without pain,
without that pain medication, with injections, with different.
Yeah. So let me clarify that. So the different types of tools would be medications that are not opioid based, rehabilitation strategies with a physical therapist or a chiropractic provider, for example. Mental health techniques. And I'll let Dr. Dupre comment on that. There are strategies we can use to help someone manage their pain without opioid medications. And then procedures. There are different types of procedures, minimally invasive procedures, different types of minimally invasive surgeries that can be quite helpful. But we'll have Jared talk a little bit about some of the strategies we might use. Yeah,
the research in the last 5 to 10 years has really increased quite a bit on alternative ways to address pain. One thing to recognize is pain is a physical thing, but it's very much a psychological, neurological thing too. And so if we can tap into the brain or other aspects of our body to take advantage of that through things like acupuncture, biofeedback, neurofeedback, basic psychotherapy, things like mindfulness or motivational interviewing techniques that help people kind of tap into what's most important to life and align what's important with their life into their activities and relationships and so forth. There's a lot of strategies where we're able to reduce the pain because we're actually increasing their ability to have more life satisfaction, life balance, almost increase their stress threshold as well. A lot of things that we can do.
So, may I just ask the question, what is the first or second step that you take for an example that you have as a patient? After you've gone through the questions and the, analyzing, then what do you do at that point?
Yeah, so I think it's important to understand it's not a cookie cutter approach. Every person's so different. We take a very holistic approach, being holistic being a WHOL, being the whole person. And so I'm glad you mentioned that we ask these questions, but we're asking questions about all these different areas, and then we customize a plan. And the plan oftentimes involves Dr. O'Bray and his team, behavioral health specialists, wellness specialists, and we follow up and see how it's going, look at their symptom reduction, and adjust as needed. And so there's never a one cookie-cutter type plan. It's all customized with follow-up using evidence-based tools. And I think that's, the neat thing, there's two things I think that's neat about this. We have so many things we can, hold on to help this person, but then because each person is so different, we can customize. I think that's important.
Okay.
And not, maybe another point to bring the table here. There are some conditions and there are some patient conditions where opioid medications may be appropriate. So it's not that they never have a role. It's just that the role needs to be carefully, deliberately thought out, discussed with the patient and their family, and monitored carefully to make sure they're safe and that they're not just used in isolation of these other strategies that we have. And so I don't want patients that do depend on these medications to feel isolated, I guess is the word, but also at the same time know that if they aren't utilizing all these other tools available to them from their medical care providers and specialists in this area or field, that they think about those because it could improve their quality of life and reduce the risk that they have for an unwanted problem or adverse event from an opioid.
Do you find that there are, with the patients that you work with, Dr. O'Bray, that there are several of them that you, through the different tools and the different procedures that you use, do you find that do most of them reach a level of pain-free or a better lifestyle than what they started with?
Yeah, I think, for patients with an acute problem, many of those acute problems can go away. And that's good news. Unfortunately, there are a large number of patients where curing the underlying problem is, at least at this time, not possible, or we don't know how. These include different types of neurologic injuries, spinal conditions that we aren't able to fully correct, other medical conditions that lead to neurologic injuries, for example, such as a neuropathy that many patients have that might experience. So unfortunately, we can't sometimes cure it in many patients. But in general, with utilizing what we have today, I would say the vast majority of patients' life can and does improve when we bring all the different tools, technologies, and experts to their care and understand their problem. So life really can improve. And that's really, I think, the message today is that, and I tell my patients, there's always hope. Hope either now with something we haven't considered or someone we haven't brought into the picture, and that's why we bring this comprehensive picture together, or with the technologies that bring advancements. And so we really don't want patients to lose hope that they're going to be stuck where they are.
You know, it's nice to know that you've got a team of experts, that you each have your own role in helping those that are in pain and discomfort and trying to help them find solutions that aren't just with opioids.
Yeah.
So, any
Yeah.
other comments that you want to make, Dr.
Yeah, I think the challenge of treating and managing pain hasn't been the only reason, I think, for the challenge of opioids across the nation we see now. But I think it's for a lot of patients with chronic pain and who are significantly suffering, it's been one of the only options available to them. And that's not really their fault. It's not necessarily their doctor's fault. It's almost a lack of developing the right system. And I think that's what we've worked hard to do, is develop a system that now provides those options to those patients that really before haven't been such in an integrated fashion. I don't know, Jared, if you'd comment on that. But
Yeah, John and I have been working on this, I don't know, it's been 3+ years now. And the system isn't used to different disciplines working together, to be honest. Not that we don't want to. I think we wanted to for a long time. It just hasn't been set up that way. And to be honest, it still isn't quite set up that way, but we've kind of pushed through. But we have developed a separate location, a separate space. We've called it Southwest Healing and Wellness, and we're trying to make it a truly integrated care location where John and his team and behavioral health specialists and wellness specialists can all be in the same space working together as a team, which unfortunately is quite unique. We have a new location on Bluff that really hasn't been open too long, but it's pretty amazing to see these patients come in and say, instead of me asking, how's your pain, I ask, how's your life? And let's help your life get better, and pain's part of that. We'll include that. But it's a very different conversation than some of the patients have had in the past. I think it's pretty refreshing. And then it's refreshing for us as providers to be able to talk to Dr. Ray or Dr. Bray to us or someone else that we talk to, because we haven't always had the chance to, none of us know everything. And being able to talk to one another and team together and work this out and problem solve together, from a provider perspective, it's higher job satisfaction too. In all honesty, it's something that we've always wanted to do. And so, I'd like to, invite people to look us up, Southwest Healing and Wellness, for, like I said, here on 1085 South Bluff Street, up in the second floor. We have a new website. It's southwesthwc.com, and new phone number 435-218-778. But I think we have something different. I'm excited about it.
That's great. Dr. O'Bray, anything else you'd like to talk about in regards to pain and how to get your patients out of pain?
I think just the message for listeners, if you have a family or a loved one, or if you happen to be a patient struggling with one of these conditions, is hang in there, keep up your hope, as hard as circumstances or times may appear to you, and know that there are dedicated people working to come up with a better way for your care and for your relief. And that's really, I think, hopefully, if anyone's listening, that's the message I hope they hear. And a big part of that is collaborating with specialists across the board to come at a complex problem with a complex approach, but a simple experience for a patient, where they're not having to hunt people down in a lot of different locations, but can really come and find
that collaboration is very.
That collaboration.
It's been a great opportunity to work as a team, hasn't it?
It has.
I'd like to talk on a personal note for just a minute. Yeah. And I've been associated with Southwest Spine and Pain now for about 3 years. And I can't remember how I first decided to go there. I've heard it from somewhere, read it somewhere, but my experience was I thought I was scared to death at first. But when they explained the procedure to me about doing injections in my back to relieve pain, I thought, how can that be possible? I had a slipped disc, and and a few other things that were affecting my back and my lower back. But they were always so gentle with me, and I had you work on my back. I've had your brother,
right.
And I've also had Dr. Christensen.
Yeah.
Dr. Christensen worked with me as well as my brother. And so we've had a great amount of success, and even my husband, he's been in there several times. So we've been very blessed with the work that Southwest Spine and Pain have done for us in our family. And I would just like to say that, this is a great opportunity for people who are listening to understand that if they've got back and spine pain, that you docs know exactly, precisely where to put that injection. You're in that room with the huge
that X-ray, the fluoroscopy.
X-ray machine and everything else, and and then you lay on the table, and they put on the floor this picture of Hawaii with the palm trees and the ocean, and you're all relaxed, and then they talk so gentle. But I guess my point here is, and I don't want to take up your time,
okay.
But I just want to say kudos for Southwest Spine and Pain. And I love the fact that you've brought in Dr. Dupre. I mean, I've only known Dr. Dupre on an educational basis, but I do know that he's had a lot of other things going on besides that as well. So this is a great opportunity. I would like to say, okay, so where does one start? Do they start with Dr. Dupre, or do they start with Southwest Spine and Pain? And how do you begin the process?
Well, I was going to say, too, if there's any questions, we're happy to take those. So I don't know how the time allows, but that's just to let you know if there's any one or two questions out there. But either one. So either one of us will collaborate. But if there's any questions, we're happy to answer those, too. So
Yeah, I actually had a patient come in today and say, do you have to be a patient at Southwest Spine and Pain first to come see us at Southwest Healing and Wellness? I said, no. And they also asked, do you have to have a pain condition? I said, no. Because we have this collaborative team that can address multiple things. We do a lot of work with ADHD, anxiety, depression, obesity, weight management. Because of our team, we're able to do a lot of different other things. The other thing that we haven't mentioned is we are licensed to help people with opiate use disorder, which is basically addiction. And so we have an intensive outpatient program, which is 3 days a week, 9 hours at a time, and also day treatment, which is 5 days a week, 8 hours a day. And so that's difficult to get as a license here in Utah. We've gotten that as of January 1st, and we're able to also treat addiction in a different way.
Okay. Dr. Dupre, would you like to say, Dr. O'Bray, would you like to say just a couple more things before we close?
I think we've covered a lot of the key topics. I guess maybe summarizing it, with regards to medical treatments and interventions, procedures, injections, we feel very confident with the expertise of our doctors and our team. And so I want people to have confidence that they'll get the full scope of options offered and procedural interventions offered that make sense for their care, as you highlighted. But I also want them to understand that we'll help coordinate their medications safely, trying non-opioid options if we can, and if necessary, opioids safely and carefully. But we'll also do that in collaboration with rehabilitation specialists and Dr. Dupre and his colleagues as wellness specialists and behavioral specialists. I guess would leave patients with the thought that we'll strive to have all these pieces of this puzzle fit together nicely and collaboratively for that patient's well-being. That would be my thoughts here to sum up and finish up.
Yeah, some of my thoughts is I think all of us kind of want the same thing in life. We want to have good relationships. We want to have good life satisfaction, enjoy what we can. And that's our goal for all of our patients. It truly is. And like I said, I've stopped saying, how can we help your pain? I asked the question, how can we help your life? And I think it's been neat to work with people that all feel the same way, that we really care about your lives rather than just a symptom or an ailment. So,
one last question I want to ask, and that is, how large is your team of experts in your offices there?
Well, the physicians we have are Dr. Christensen, Dr. Rick O'Bray, Dr. Derek Frieden, and myself here in St. George. We have an excellent team of nurse practitioners and physician assistants. We have Dr. Dupre, Dr. Eschler,
Lori McBride, a social worker, Alberto Sousa, who has a psychiatric care specialty, and various other people that help with other things too.
Thank you very much. You've just been listening to Southwest Spine and Pain Back to Life show with our host, Dr. John O'Bray and Dr. Jared Dupre. Thanks for joining us. Tune in each Monday evening, 5:30 to 6, for Southwest Spine and Pain Back to Life show.
Join us for Back to Life every Monday at 5:30 p.m. here on St. George News Radio, where board-certified physicians from Southwest Spine and Pain discuss different alternatives to live life again pain-free.